Welcome to another Medical Minutes. And this Saturday, we have a special speaker. She will talking about advanced suprasegmental evaluation in medical thermography. So keep calm. Thermography are here. And are you ready for this? Sure. So today we have Belén Borja, a powerful house in medical evaluation and medical in the field with last year background. Welcome, Belén. Thank you.
Directly the content through subtitles, and honestly, talking while I watch from the use you my AI alter ego perfect PowerPoint presentation. So
clue of what happens when a child has zero creativity control. I absolutely loved it. While everyone was sleeping at my wrist, she had a daughter who sat on my table waiting to be. But that's a story for another day. That's as Holmes said. You see, in thermal analysis, each one to uncover requires individual fingerprints. They design pulling all the strings from above. They missed the suprasegmental level. Today, we're going to solve the case that's been 130 years in the making. We're going to reveal how sight. Welcome to the era of suprasegmental evaluation, where thermal detectives finally learn to read the mind's fingerprints. It all started in the 30s and 40s, that meaning operational. But here's what existed in parallel universes. It was recognizing that to witness the next chapter, medicine, where important clues just like the hypothalamic level analysis and thermal patterns follow neurological blueprints like a mysteries hiding in plain sight. We won't dive deep today. This is foundation work. These have investigating just when you want to finish with specific spots where these points also coincided perfectly. It was like finding love by neural networks in London. I discovered that ancient centuries before Christ, criminals' hideouts, sophisticated names that hint at their true function, placing needles. This isn't mysticism. Journal showing astonishing, remarkable precision in Chinese point locations. I found something extraordinary mapped as lung, mu, and shu point, mu, and shu locations. Clues, but never catches the criminal. The Chinese, however, used their points for both diagnosis and treatment. They weren't just finding the evidence, they were communicating with the master. He was a complete crime network we've uncovered. We create tenderness on the skin at very specific points. But here's the breakthrough. This isn't just a one-way street. Stimulation of these points can actually communicate back to the internal organs. It's like having a direct telephone line to the brain's central command. We're not just observing the crime, we're learning to speak the criminal's language. Before I reveal my suprasegmental breakthrough, let me show you how thermal imaging validates what organ-skin relationships through touch. Pure detective visualizes with precision. We can see what head could only feel. Today we know that bidirectional organ-skin communication occurs via the nervous system. Head touched the truth. We can now see it in living thermal color. But head stopped at the segmental level. He never discovered what controlled it all from above. We found the evidence head zones, Chinese point, the mastermind. Here's our breakthrough evidence. The autonomic nervous system doesn't lie. It reveals what patients won't or can't tell us. Our suspect? The hypothalamus brainstem complex, hiding in plain sight. Our weapon? Neurovegetative dysfunction leaves thermal fingerprints impossible to fake. The face, eyes, and nose provide our direct neural connection to catch this criminal red-handed. Ladies and gentlemen, after following all these historical clues, I can now reveal our complete three-tier detective framework. This is our window into the hidden control room of the nervous system. But here's something important. As true detectives, we didn't present these levels in logical order. We followed the evidence chronologically. We honored Sir Henry Head, who discovered level 2 visceral connections, long before we understood the mastermind at level 1. Level 1 suprasegmental, level 2 visceral. Organ-specific thermal signatures projecting to skin zones. This is where Head made his breakthrough. Level 3 segmental. Spinal nerve territory showing local inflammation patterns. For the first time in medical history, we can see all three levels simultaneously through thermal imaging. Stress index, our stress formula. Maximum VTT minus minimum nose temperature. Look at these thermal mugshots. 0 to 5 degrees Celsius equals our model citizen normal stress level. 5 to 10 degrees Celsius puts someone under surveillance moderate stress level, we're watching them. But 10 degrees Celsius and above? Criminal identified. Severe stress level. The beauty is the autonomic nervous system can't lie to us. You can fake a smile, control your words, even your heart rate to some degree. But you cannot fake your thermal signature. It's like having a lie detector that reads the brain's honest signals directly. Now here's where our detective work gets sophisticated. The BTT brain temperature tunnel is our direct hotline to the criminal mastermind. Blood flows directly from the brain through the internal carotid, travels via the ophthalmic artery, and emerges at the medial acanthus where paper-thin skin reveals brain temperature. It's like having a direct telephone tap into the brain's headquarters. Normal range 36 to 37 degrees Celsius, measured at 0.95 emissivity, using a 45-degree oblique angle. Location, that thermal drop at the medial acanthus. This isn't just temperature measurement, it's brain surveillance. Now here's where our thermal detective work gets really sophisticated. We've discovered there are two completely different criminal profiles. Direct stress, the primary victim pattern. BTT increases above 36 degrees Celsius. Nose gets intensely cold. This is fear, alert, fight or flight. The brain is on fire, working overtime. But empathic stress, the shared suffering pattern. BTT decreases below 36 degrees Celsius. Nose still cold. This is worry, care, shame. When someone suffers because others are suffering, it's like having two different types of crimes with completely different thermal fingerprints. Ladies and gentlemen, meet our star case study, fibromyalgia, the perfect example of how suprasegmental evaluation solves medical mysteries. The 9-to-1 female ratio reveals how women's evolutionary empathy becomes medical liability. Thermography allows us to identify what we call the thermal signature of fibromyalgia, the famous mantle sign hyperradiation in the cervicothoracic region, cold extremities reflecting vasomotor dysfunction, the fatigue mask, periocular temperature increase related to sleep disorders, and the lumbar pattern with paravertebral hyperradiation. These patterns, combined with low BTT, less than 36 degrees Celsius, and high NSI, 7 to 12 degrees Celsius, paint the complete thermographic picture of this syndrome. Here's one of our most important diagnostic discoveries, the owl eyes pattern. Look at this progression. Normal eyes show even thermal distribution. Mild congestion begins with periocular hyperintensity, but severe owl eyes show distinct hyperintensity around both eyes. The meaning? Sleep disorder and chronic fatigue. The correlation? Fibromyalgia and chronic stress. The mechanism? Vascular congestion from autonomic dysfunction. It's like the body is literally wearing thermal glasses that reveal its exhaustion. This slide reveals perhaps the most profound discovery. During normal sleep, BTT should peak at sleep onset, drop 0.5 degrees Celsius during deep sleep when the brain's cleaning cycle activates, then rise again at awakening. But in Alzheimer's failure, there's no nocturnal BTT drop, leading to amyloid accumulation. The brain never gets its nightly cleaning service. This explains why sleep disorders often precede dementia by years. We can literally see the brain's janitor going on strike through thermal imaging. Here's our complete thermal diagnostic spectrum. Below 36 degrees Celsius, hypometabolic, suspect thyroid issues or chronic fatigue. 36 to 37 degrees Celsius, perfect homeostasis, optimal brain metabolism. Above 37 degrees Celsius, hypermetabolic, inflammation or autoimmune activity. Above 38 degrees Celsius, fever, environment compromised. Think of BTT as a brain barometer. It tells us exactly what kind of metabolic weather is happening inside the skull. Finally, here's our forensic protocol for thermal detectives. Step 1. Bilateral BTT at 45 degrees angle, 0.95 emissivity for accurate readings. Step 2. Nasal minimum, scan entire surface to find coldest point. Step 3. NSI calculation. Calculate absolute difference and percentage. Step 4. Periocular symmetry check for owl eyes pattern. Precision is crucial for reproducible results. Consistency builds thermal case files that stand up to scrutiny. We're not just taking pictures, we're building evidence. She was absolutely fine. No stress, no problems. Her voice was steady, her smile practiced, her denial complete. But look at this thermal evidence. NSI 13.3 degrees Celsius. Severe stress. Her autonomic nervous system was screaming what her mind couldn't acknowledge. This patient was so deeply blocked by ongoing abuse and mistreatment, she had completely disconnected from her own suffering. She literally didn't know how devastated she truly was. When confronted with the thermal evidence, when the images revealed her hidden trauma, the walls came down. The truth finally had a voice. After comprehensive treatment, acupuncture, phytotherapy, energetic nutrition, and much emotional coaching, the NSI dropped to 1.9 degrees Celsius. But more importantly, She found herself again. This is why thermography is the ultimate truth detector. Sometimes the body remembers what the mind has been forced to forget. Traditional medicine relies on subjective reporting. Patients can fake symptoms. They can manipulate pain scales. They can lie. But thermography, impossible to fake. 0.1 degrees Celsius resolution, 100% reproducibility, physiologically determined signatures. We've moved beyond the realm of medical guesswork into forensic level evidence. Every thermal pattern tells a story that cannot be fabricated. Imagine if you could see disease before it announces itself. Imagine if you could detect dysfunction in that precious window when it's still reversible. Thermal changes appear first, before symptoms, before laboratory has always dreamed of. The evidence is overwhelming. First, BTT is the cerebral thermal fingerprint, a unique identifier that reveals thermal signatures. Third, thermography is the nervous system's polygraph, an unfakeable autonomic truth detector. Fourth, suprasegmental evaluation completes the diagnostic puzzle, the essential missing piece we've been searching for. Case closed. But this isn't just theory. This is revolutionary practice. Sleep disorders, detect them before the first yawn. Stress management, quantify it, track it, master it. Neurological screening, catch brain metabolism changes at their very beginning. The applications are limitless. Let me show you some you're going to love. The future is here. Imagine detecting autism before behavioral symptoms fully emerge. Unique facial thermal patterns reveal different autonomic regulation, different thermal reactions to social stimuli. Early intervention windows open when it matters most. Child-friendly, no discomfort, just thermal magic revealing what we couldn't see before. Now here's where thermal detective work gets absolutely fascinating. Your nose isn't just for smelling. It's a sophisticated air conditioning system that reveals your autonomic nervous system in action. Watch this thermal respiratory cycle. During inhalation, cool air enters the nostrils. You can see the blue thermal signature as fresh air flows in. Then comes the cooling effect. Nasal temperature decreases as that cool air passes through. But here's the brilliant part. During exhalation, warm air exits the nostrils, creating the red thermal pattern you see. This creates a warming effect where nasal temperature increases. This cycle happens 12 to 20 times per minute, and our thermal cameras can detect every single breath. It's like having a respiratory polygraph that never lies. When someone is stressed, anxious, or experiencing autonomic dysfunction, their breathing pattern changes, and we can see it instantly in the thermal signatures. This is suprasegmental evaluation at its finest, the brain's control over breathing, revealed through simple nasal thermal analysis. No sensors needed, no invasive monitoring, just pure thermal intelligence. Your car becomes your wellness coach. Dashboard thermal cameras watching your stress levels in real time. When stress hits the danger zone, beep. Time for a break. Perfect for truckers, delivery drivers, anyone whose job involves wheels and stress. Your thermal co-pilot keeping you safe. Microsleep, not on our watch. Thermal signatures change as alertness drops. A region temperature shift screen, wake up. Before you even realize you're drowsy. System alerts before the nod, preventing crashes before they happen. Your thermal guardian angel never sleeps, so you don't have to worry about sleeping when you shouldn't. My fellow practitioners, the game has changed forever. No more medical guesswork. No more diagnostic uncertainty. Transform your practice into thermal detective work. Use objective, measurable evidence for better outcomes. See what others completely miss with suprasegmental evaluation. Your next steps are clear. Standardize your measurement protocol. Build your thermal database of cases. Integrate all 3 evaluation levels. Become the Sherlock Holmes of thermography. And this is just the beginning. Hospitals detecting sepsis early, airports spotting stress, classrooms identifying learning struggles, sports optimizing performance. The thermal revolution is everywhere. When I was 8, I dismantled that pocket watch piece by piece, searching for the secret of time. Today, we've cracked the code of the human thermal mystery. The game is afoot. If you met you, would you like you? When I was 8, taking apart that, not just accept what others told me. Today, when you're lying on that examination table, vulnerable and seeking answers, wouldn't you want to know that your specialist has that same relentless curiosity? That same refusal to accept we don't know as a final answer? If you met your doctor, would you trust them? Would you see someone who stopped learning years ago? Or someone who's still taking apart the mysteries of medicine piece by piece? The 8-year-old in me never stopped asking why. And that's exactly. Dear thermal detectives, we've reached the moment of truth. When I was 8, I took apart my own pocket watch and never managed to put it back together. But today, I've finally assembled all the pieces of the thermal puzzle. Welcome to Body City Underground. I know you're all eager to short circuit with me and connect the dots. You know what I call touch. This image contains tons of information, but I need you to start a picture when we make touch, connecting all the dots together. Look at our transport lines, the circulatory highways. Red line for energy delivery, blue line for waste removal, green line for brain communication, and more. Every thermal pattern follows these highways. Meet the mayor, your brain commanding from City Hall. The mayor has 2 critical windows. City Hall brainstem for automatic operations, and the mayor's window your face and eyelids, showing stress levels. The eyelids are the sleep quality indicator. When you see eyelid asymmetry, the mayor is under stress, struggling to maintain order in the entire
Tá
city.
escutando?
Now our underground stations.
Não.
Abdominal district with heart station, liver station, kidney station, etc.
Hum?
Each has specialized agent teams, your
Eita,
neurocontrollers sending
não
thermal
sou eu?
signals to the surface.
Sou.
Meet our agent spinals, neighborhood patrol officers
Você quer
protecting F
discutir aqui?
district. When
Dar
agent
sua opinião?
L4, L5 reports inflammation, the mayor opens thermal valves wide in that segment. Here's the breakthrough. Your sympathetic nervous system equals smart valve controllers. Normal
Gabriel.
valves respond automatically. During inflammation, mayor
Não sou eu que
commands,
estou dando
open
aulas.
all valves maximum. During
Saco.
exhaustion, valves get stuck. This is what we see in thermal imaging, your body's intelligent healing response in real time. Traditional imaging shows structural problems, but 80% of chronic pain has a no surgical lesion. They have functional alterations, exactly what Body City reveals. We're witnessing the communication
Bora.
symphony of your body's
E
healing
vai, Zé. Tchau.
intelligence. Ladies and gentlemen, we've solved the 130-year thermal mystery. 3 integrated command levels, transport highway, specialized agents, smart valve control, real-time healing intelligence. Your body is a smart city with mayors, underground networks, and patrol officers working in perfect thermal harmony. I am the thermal mastermind and author behind Body City Underground. Take it away, Belén. Now my NSI must be screaming so loud that you can probably hear it from the USA and Brazil at the same time.
Hey,
Amazing. Very
that's
good.
wonderful.
Yeah. You summarize many concepts here.
Yes, it was
Very good.
such a big concept that, well, I always say that I've got my own language. I always say that my own language helps me to understand difficult concepts. This is why I'm so creative. And, I always say as well that knowledge should be. So this was my way of explaining this to myself first and then to you. Hope you like it.
Oh, thanks so much. Thanks so much. I believe there are many questions here. I'm just first give you like the examples you put like about the eyes and fire in the eyes and to stress now. So it's very common. Images is a very stress. The noradrenergic stress, emotive stress, and but in a biological window related with vasomotor response on the peripheral vasomotor response and core response. So it's very interesting how infrared can help to monitor this. You present if the person is lying or not lying. So it's interesting. But don't go ahead. It's opportunity to share acknowledgement here. Kenny.
She did to just take that master concept and turn it into the city concept. I think that was brilliant. So, very congratulations on that. I had 2 questions. One was a definition question. You mentioned the term BTT. Could you explain to me what that means?
Yeah, BTT is brain tunnel temperature. So
Mhm.
in the medial angle of the eye, we've got a way to measure the temperature of the brain. So
Okay.
are able to compare the temperature of the left eye with the right eye. Then we can see the asymmetries, and then if we've got some asymmetries, then we know that something is not going properly.
Okay.
Way of doing But also, we've got what we call the war thermography. So sometimes one is on a hurry with a patient and just do it straightforward.
Yes.
This would be also a possibility, but the most exact way would be the 45 angle.
Great, thank you. My second question, it had to do with the thermal patterns you were mentioning related to autism.
Yeah.
I've got a client right now that I do interpretations for, and she specifically deals with a lot of autistic children. And she was looking for things that can be used to help identify signs, to monitor. So, what do you look for specifically in an autistic child or an autistic person to know that it's related to autism and be able to monitor it?
Well, for me, one clue is the BTT, and the face for me is the primary question.
Mhm.
I went through a lot of papers and found different ideas. So, still working on this, but of course, there is a different pattern on these people. But I just found out that depending on the age, this pattern may also change. So if you are interested, I can share with you those papers.
Yes, I would love that. And if you do end up teaching a class at some point, I'd certainly be interested.
Okay,
Yeah,
let's go for it.
please keep me in mind.
Okay.
Thank you.
Thank you, Robert.
The BTT is a concept developed by Mark Brill. He's Brazilian, but naturally he's from US, from Yale University, and the concept is more related with brain metabolic rate. So it's a way to study the brain metabolism directly by the eyes, and with this you can connect with infections like fevers, problems, but also with brain reactions, and especially you can have some idea of the right and left brain reactions. Sometimes there's some studies about that, and some studies with heart diseases also, and stress, sleep problems. So there are very amazing, interesting things with this concept. And in autism, we have some questionnaires, some questions we can do to test someone, and we can monitor the vasomotor reactions the face during that questionnaire. So psychiatric or psychology specialists can have some information with the questionnaire, but with infrared, it's a way to have this really more clear to understand the grade of autism. I believe the grade is very important because during the treatment or during the monitoring, uh, maybe it's easy to know that someone has autism, but how's the grade, how his reaction on that day. So, and it is open window for treatment and monitoring of these people because they have different reactions of a normal people has. So during a stress questionnaire or basic question, so the vasomotor reaction is different. For example, you put then on the stress become much more higher response on the nose, on the eyes than a normal person. And or when you're talking with him, there's no reaction between the left and right side of the brain, so you don't see difference on the maximum temperature of the eye. When you using the right side of your brain much more than the left, in for example, when you're stressed, uh, your right eye becomes more high temperature than the left side. And when you're more calm, it changes. So there are some papers on animals and children, adults, and measuring not just the eye temperature, but the tympanic temperature. So it's very interesting, this line of research. But it's a tool, it's not diagnosis of autism or diagnosis of stress. It's something, oh, there's something wrong here. Look like in this situation, a stress situation or anxious situation or autism situation.
And I
Yeah,
imagine it can be used as a monitoring tool as well. You see a certain level of activity, something that could be related to brain function, and then a therapy is introduced, then you could see, was there some sort of rebalancing or improvement?
Yeah, it's a
correct.
biomarker
Yeah,
to measure.
Right.
and Marcos mentioned something really important, and I guess that for autism it would be great not only to do some to take some pictures, but to do live thermography while questionnaire. This changed it all.
Mhm. And
So
also
if
on
anyone,
depression,
yeah,
yeah. Depression, for example, you have the BTT temperature is more low, decrease the temperature on depression cases. And schizophrenia patients, you have much more high temperature of the brain. Sorry, I thought that the right is when you're nervous. No, it's on the left when you're nervous and right when you're calm. And well, there's a lot of questions here. There's a lot of very interesting things
let's
on
go
this
ahead.
presentation. Come on. If you want, anyone wants to do in Portuguese or in another language,
Yeah,
we can
this is
try
what I was
to
going to.
translate. Go
I
ahead.
can speak both languages at the same time, or I will try at least. Gente, se vocês têm uma pergunta em português, podem falar. Vou tentar falar as duas línguas no mesmo tempo, tá?
Aproveitem. Spanish too. Spanish too. Xavier.
Yeah. Thanks God we don't have something from Germany as well. I also can speak German, but just three languages would be too much at the same time. So I hope you understood what I tried to explain at the very beginning related with this watch that my family gave me as a present, because something for me that is really very important is to connect all the dots. And for me, suprasegmentary level is just this, connecting the dots. I used to call connecting the dots touch, like tocar in Portuguese, tá? Just because there was a film on TV of an autist boy. And this autist boy was capable of connecting a lot of things before the other people was. But he was still needing his father to take the action to avoid problems. So this film, the name was Touch. So from then on, I keep on telling myself, oh, patience, a lot of problems. I need to connect the dots. And for me, this is suprasegmentary level, people.
And one topic that we discussed, thermography and suprasegmental thermography. So, for example, when we have a chronic pain on the shoulder or on the back, you can do the images on the shoulder, see inflammation, any radicular problem on the back. But it's very important to do the suprasegmental images too, or analyze them. What means that you must to do the shoulder and the back image, but also the face image, and understand on the face image the suprasegmental or a high noradrenergic response or a sleep problem. So in the same report, you can connect both information, segmental, specific where you have the pain, and suprasegmental as additional information to do a full approach of the patient, not seeing just the problem, but understand the autonomic nervous system in a full aspect. So you can work with stress, we can work with other dreams, and here we open the claim of the patient, and the results must be much better in the treatment, and also infrared imaging will contribute much more for diagnosis, very, very, very beyond the MRI, tomography, X-ray. So we open many windows of the problem and bring different ways to treat the patient. But it's as something new, not for us, but for many people, it's something new. We must to educate or explain to our friends, to other physicians, other health professionals, that the infrared image can open these windows, can help them to do different approaches of this patient, not only locally, not on the breast tumor, but to understand suprasegmental effect when we have a tumor and what has happened, treatment and these things. And it's a new culture, it's a new objective way to show to people. So we see many different schools of treatments, and infrared is a way to join all of these schools, as pointed Belén at the beginning when she showed us about acupuncture, and after she talked about stress, and after she talked about metabolism. So it can connect different treatments, cultures in one approach. It not means that I need to know how treat acupuncture. It not means that I need to know about acupuncture, but I can do a report. I can what is happening on this situation. So we can open these doors independently if we do that treatment or not. Can open the door for hypnotherapies or manual therapy, a chiropractor, or a neurosurgery and neurology. So to explain to them on the segment and also to help the patient. There's a question from Sidalia. Okay, go ahead.
Yeah.
Okay.
Yeah, so he was asking what was the difference between the different types of stress I explained before. So let me just share again that slide. Just one say. Okay. You are able to see my slide, right?
Yes.
Oh, I guess I put the video. Well, doesn't matter.
Thank you for translation in Portuguese.
Yeah, no problem. Okay, so I was just explaining that there are two different types of stress. There's one which we call direct stress, which is related with fear and with this alert we all know for fight or flight, right? And then we have the empathetic stress, which is related not only to worry, because sometimes we see this when one person is worried about another, but it's also related to care and shame and empathetic stress. So don't think only about empathic stress, but also about shame, very important. Let's see that case I showed you.
Yes. Just to explain, when here on the hepatic stress, the BTT is decreased, so you have a brain metabolic decrease. And what means that hepatic stress is more related with a chronic suffering. And in a chronic suffering, you have depression. And when you have depression, your BTT decreases. And here, in direct stress is something like acute stress. It's something more. It almost happened in this recently. So the BTT increase a lot, and the nose decrease is like a autonomic common reaction that most of us understand. But most of the patients have empathetic stress, so they are suffering from their sons, fathers, or someone a victim of problem or disease, something like that. And what is important for us during the exam? What's important is information that we must not only treat the pain or the back pain, but asking, oh, okay, but what's happened with you? What's the problem? No, it's my back pain. No, it's not only the back pain. Well, you're suffering with what? I'm suffering with my mother. So you understand most of the time there's another context or another source of pain on these chronic pain patients. Thank you, Belén.
That's right. I put here two pictures. One, the empathetic stress one, the right one. You can see here that the noradrenergic index is 11,2, which is higher than the 7,7 from this
Mhm.
person. But in this case, you can see, well, I guess it's very small for you, but the BTT is 33,4 degrees, Celsius degrees, right? Which is very low for a person. And this is related to the chronic disease, which Marcos was commenting before. In this case, however, although the noradrenergic index is 7,7, the BTT, the difference between the maximum temperature of the eyes is higher, is 36,5 Celsius degrees, which is not that high, but is higher. Therefore, this is why I put here, it should be the BTT higher than 36. Go ahead, Marcos, please.
This direct stress, most of time the patient is feeling pain on that moment. So it really hurts on that moment. There's a compression, there's inflammation, arthritis on that moment, like in between 0 to 10 is a 8, 9, 10 grade of pain. So he's really suffering of pain on that moment. And on the empathic stress is a pain, but emotional pain. It's something that comes, is different. It's not directed to the tissue, but more to the social, emotional aspect.
So I've got a questions for all colleagues here. Just write your answer on the chat. Let's review again this case. In this case, NSI was 13,3 before treatment, which is really, really, really high. I don't know if I'm able, oh yeah, that's great. Here you can see it better. Then we've got the right eye maximum temperature was 33,9, and the left eye was 34,4. So my question is, in this case, people, is this empathetic stress or is direct stress? Please write your answers on the chat. Go ahead. Come on, or your
Teacher,
microphones as well. You
teacher
can do it
asking,
all at the same time.
really,
Margareth, nós estamos
Margaret,
falando do empathetic stress e você sabe muito de isso. Eu estou perguntando se essa menina aí, people, I'm just translating, right? Se essa menina aí teria empathetic stress ou não. O metabolismo, eu já mostrei aqui, 34,4 ou 33,9. E aí? A gente, ninguém me escreveu no chat. Não acredito, gente.
come on.
Come on.
Passa, repeat again the question more,
Precisa
more basic.
revisar. A pergunta é a seguinte, vou fazer de novo. Nós já vimos aqui que temos dois tipos de stress. Primeiro, direct stress. E segundo, empathetic stress. The important difference is that in the direct stress, the metabolic would be higher than 36 Celsius degrees. I know that in US you don't work maybe with Celsius degrees, but in empathetic stress, the metabolic degrees would be lower than 36. So this is the difference. Okay, we've got our first answer. The other people is still really shy. So let me go again through the picture of the case. Of the right eye is showing 33,9 Celsius degrees. And the left eye is showing 34,4 Celsius degrees. Is this higher or lower than 36? This is what tells us what kind of emotion this person is suffering. Come on, Robert. I'm still waiting for your answer.
Oh my God.
Don't be shy.
Don't worry, you have a 50-50%
Exactly.
to be right or wrong. Oh,
You can
empathic.
say Spanish. empathetic.
It's
Okay.
okay, Belén, empathic.
Okay, congratulations.
Oh, great.
Congratulations. So I hope this is clear now, the thing about empathetic and direct stress. But just please remember that when you see in a patient shame, culpabilidad se fala en portugués, ¿no? When you see this, you are going to find empathetic stress as well, right?
Yes, but
So quick question if I could make. Now, I'm assuming somebody that has a fever would also have an elevated temperature there as well. And the differentiation would literally be, do they have any signs of fever? Do they have any, did we measure oral temperature or something like that as well? Would that be the correct way to kind of process the information?
Well, first of all, one image doesn't make a diagnostic. We also
Right.
need a historical clinic document, right? But
Right.
then you also can just calculate also the noradrenergic index that we saw. BTT minus minimum temperature of the nose. Was this
Right.
your question? I don't know if I went through right.
Yeah, no, it does. I think part of me wants to take the class where I can learn the indexes and a lot of the back information that you're using. But no, I can follow your logic. It's really cross-correlating to the other clinical signs and symptoms and the rest of the history information.
Yeah.
yes, yes, it's very important.
Really.
Yeah.
Yeah.
It's very important to correlate with the clinical aspect. So we must
Yeah.
to take care not to put this information on the report. If you don't connect with this with the history for a patient with depression or crying or blah blah blah, and with based on the images, results could be empathic stress could be. So you must to correlate or don't put you asking during the consultation for the person.
Right.
But yes, we must to contextualize with the because when, for example, if you're doing the exam to study the pain, the cause of pain, you put this, so you must take care. You can put, but you must to correlate well this information.
Right. Well, that is exactly the issue that I face is I want to provide information to people, but I want to make sure that it's provided accurately so they're not believing they've received a diagnosis or that we've screened for a particular condition when we've just identified a biomarker. What is that balance between providing information but not overrepresenting the significance of the information?
Yes,
That's
because
right.
most of people don't know. Oh, sorry. Most of people don't know what's empathic stress. So if you put empathic stress, they what's this? I never heard about. So it's a very specific term of the people who really study this, or most of the time is psychologists. And
Right.
if you send for a neurologist, it not means you understand what's empathic stress. Oh, is it stress or empathic? I don't know. It's strange.
Yeah. And also, as your question was really interesting because now what I'm thinking is, why don't we all share some videos, some face thermal images in our WhatsApp group so that we can share our results? Because yes, there are some papers talking about this, but we still need to analyze more. We still need to provide more data in order to analyze it. Even there is not only this information about the stress, but there are some other patterns related to different emotions. So the thermal pattern is not the same if you are happy or if you had a breakthrough yesterday.
Right.
And this is, well, is this important? For me, it's important because those are clues that let you give a better treatment to your patient. So we need to see the whole picture of the patient situation. So we could talk a lot about this. There are still some papers about this, but I'm sure that we will provide more information to the science in order to keep learning about it.
Ask. Rodrigo, do you have any question? Go ahead.
Yes, I wrote in the chat.
About the tour? Oh, you wrote in the chat. For BTT
Yeah, if
maths, yeah, I was just joking with you about teeth. For BTT maths, is there a specific time to do this examination or any preparation to do this? Okay, this is really important because I was thinking about it some time ago. Let's say you've got, you follow the normal protocol when meeting a patient. Your consultant is 23 degrees or whatever, the patient stays there for a thermalization and so on. But imagine that the boyfriend of this girl is calling her just before you see her. What is going to happen with BTT? What is going to happen with noradrenergic index? So there's some things that we cannot really control. You cannot tell your patient, please don't answer the phone before you come here today. But I would say that this BTT may be different if you do it during the morning or during the afternoon due to circadian circuits. So this is really important. If you see your patient at the same time each day they visit you, it would be better and the results would be better.
okay, very good, very
Answer?
amazing. Did you like this kind of class today, medical minutes? So raise your hands if you like it, because we are thinking to do the congratulations, Belén. Belén is open a different kind of approach, and we are preparing a training course for the next Saturday, or not next, or maybe on the one or to the next Saturday, where you can see the classes before, and after we can go to here to discuss with more detail. So we are preparing a course where you see the class, a long class, in your time, with your time, prepare a question, and after we return to discuss with those that saw the class prepared for the teacher. So I'll be doing that. Belén, Sergio, and others, Vidalia, and other professors will be invited to do this way. But I'm trying to send you on this week how it works, and it could be a very interesting way to learn more infrared imaging and share information. So